Dr. Atul Nakhasi, MD, MPP. Dr. Nakhasi is a faculty member at Charles University and also works with me at Martin Luther King Outpatient Center. He recently became the Director for Science and Policy in the Office of the U.S. Surgeon General. The mission of the office is to protect and promote the public health of the nation. In his role, Dr. Nakhasi oversees the science and policy priorities for the nation's doctor. Dr. Nakhasi also serves as a primary care physician within Los Angeles County Safety Net Health Systems. He attended Johns Hopkins School of Medicine for his medical degree and the Harvard Kennedy School of Government for his public policy degree, where he was named as a fellow of the Harvard Center for Public Leadership. He has been featured in the Washington Post, Wall Street Journal, ABC World News, Good Morning America, MSNBC, and CNN. And I also frequently see his articles in the LA Times. He hails from Iowa, born and raised among the cows and cornfields in the Midwest. Thank you so much for taking time, Dr. Nakhasi, to join us, and please go ahead.
Thank you, Dr. Friedman. Very much appreciate the time today to be here with everyone. And also just thank you to Norma for sharing such a moving story and the commitment to service that was clear from her life story. So thank you, Norma, for organizing this. Dr. Friedman, you've been a professional colleague and mentor of mine, an accomplished researcher, academician, and clinician for our community. So thank you to you as well, and to everyone who's sponsoring this program. I'm proud to be a Charles Drew University faculty member myself, in large part to Dr. Friedman's professional mentorship and sponsorship, as well as faculty at UCLA, and a primary clinician here at Martin Luther King Outpatient Center. So really a special moment to be able to be here with everyone and also represent the Office of the U.S. Surgeon General. And thank you to all those who are sponsoring the program and the tobacco-related disease research program as well. So on behalf of Dr. Vivek Murthy, our 21st U.S. Surgeon General, it's my proud honor to be able to support this great work and all everyone is doing to advance the area of tobacco-related research. Still today, as Norma had shared her own personal story, still today, nearly 1 in 5 U.S. deaths are related to tobacco-related deaths, 1 in 5 in today's world of 2023. That amounts to almost 500,000 lives lost per year, 500,000 in the last 20 years. That's about 10 million people, 10 million lives over 20 years due to tobacco-related disease and mortality. And so much work still continues to be needed. Much of that is driven by those who are attending today, this session here, but there's also hope. There's also hope. In 1964, that was the same year the Federal Trade Commission voted to include a Surgeon General's warning on cigarette labeling and packaging in 1964. At that time, Dr. Friedman, Norma, and all esteemed colleagues here, 40%, more than 40% of the country smoked in 1964. Today, less than 14%, less than 14%. So just over that span of decades from that initial labeling and efforts to mobilize around decreasing tobacco use in the population, we've seen also tremendous progress from 40% of the country to 14%. And so with that, I'm actually very excited to also share that we have plans to release the 35th Surgeon General's report on tobacco. So with that, I'm very excited to be able to share that later this year, we will be releasing the 35th Surgeon General's report on tobacco with a specific focus on tobacco-related disparities and health equity. It will be the first report in 25 years, a quarter century, on tobacco-related disparities. Because of how important that is. Norma's story and the stories of so many of us, even those within our community here in South Los Angeles, illustrate the importance of closing those gaps and eliminating disparities. And so we really look forward to working with clinicians, community members, families, academicians, researchers to partner in this effort, and look forward to continuing to be by your side and in support of this in the years to come. And finally, just in closing, before we introduce our keynote speaker, you know, I take deep pride to be able to care for our underserved community here in South Los Angeles, in the Willowbrook, Compton, and Watts areas and communities and surrounding Los Angeles, South Los Angeles area. I'll just share this one last story to close. I'll never forget one of my first encounters leaning into tobacco cessation when I first started practicing here. And I had a woman, she was in her 60s, and I was assessing her readiness to quit. And she said, Dr. Nakhasi, I've been smoking since I was 15. I was smoking since 15, and I'm now 65. But I've been thinking about quitting smoking, and I've been considering it, but I just haven't made that step yet. And she looked me in the eyes and she shared her personal story and journey with tobacco, this desire to quit, motivation to quit, but just hadn't taken that step yet. And in that day, I leaned into that conversation. I offered her the support she needed, the counseling to help her overcome the tobacco that she had wanted herself to quit and abstain from, and leaned in and prescribed varenicline, helped support her through medication therapy as well. And I'll never forget, 2 weeks later, I received a note from her saying she had quit completely. Dr. Nakhasi had stopped completely, and now she's at 5 years to date, completely abstained from her tobacco use as of today. And that was one of my very first encounters in our community with my patients, to really see the power of our voices, of our education, of our empowerment in our patients' agency over their health. And so this work really matters. And it matters because by 5 years, the risk of heart disease for our patients and for my patients, it drops by half 5 years later from abstaining from quitting. By 5 to 10 years, her risk of oral cancer, pharynx cancer, larynx cancer drops by half. Her risk of stroke decreases. By 10 years, her risk of lung cancer decreases by half. And by 15 years, her risk of heart disease drops by that of someone who does not smoke at all, by 15 years. And that's the power of the work we do. That's the power of what a collective community in this effort to reduce tobacco-related disease and mortality can do. And there's countless stories like that of patients who we've helped support in their journey toward tobacco cessation. So the evidence, the bottom line here is the evidence is clear. One of the most important actions people can take to improve their health is to quit smoking, no matter how old they are and no matter how long they've been smoking. And I appreciate so much, on behalf of the Office of the U.S. Surgeon General, the work you all are doing in that spirit to help our community, especially our underserved communities. And we're proud to be your partners in the years to come. And so